Hello, dear friends. My name is Sofya Dorinskaya. I am a psychiatrist and the head of the Center for Medical Information. Today, I want to tell you about a situation, or yes, you could classify it in different ways, that I came across on the professional medical website Doctor at Work. What do we see on this Doctor at Work website? So, what is the doctor being asked to do? To analyze a clinical case, a psychiatric case. All right, let's read. It says, clinical case. You have a male patient, 27 years old. His wife brought him in for a consultation after she heard her husband talking to voices in the morning. From the interview, it turns out that the voices in the patient's head appeared about a month ago. Remember that. They blamed him for failures in his personal and professional life. The patient says that he began to notice unpleasant changes in his well-being 8 months ago. So the situation has been going on for 9 months already. It all started with him becoming more indifferent toward his wife and child, cutting off contact with friends, no longer enjoying life, and being fired from his job due to increasingly frequent absences because he didn't want to get out of bed. So yes, it really is an interesting case and it needs to be looked into. But what do we see next? A question for doctors. Which atypical antipsychotic would you prescribe to a patient with predominantly negative symptoms of schizophrenia? And here you have 4 neuroleptics to choose from. A caption, the name of the pharmaceutical company, and their slogan, "Health is our mission." Listen, guys, I have to say that this is an absolute crime. It is a genuine medical crime because this specific clinical case provides no valid reason whatsoever to prescribe any kind of therapy for one very simple and fundamental reason. As a professional doctor looking at these facts, I have a serious question that needs an answer. What exactly happened to the patient during the course of this treatment? And why are we not seeing the necessary diagnostic data to justify these actions? So, what are we actually observing? Over the course of 8 months, the patient's condition progressively worsened. He became more indifferent, meaning he lost his emotions. He no longer had the energy to interact with friends. He stopped deriving pleasure from life, to the point that he couldn't go to work because he couldn't get out of bed. And so we see that this situation drags on for 9 months, and he began to experience hallucinations. We are witnessing a developing catastrophe in a person's body. And what is actually needed? This person needs to be sent for such a comprehensive examination with so many specialists that to say he should simply be prescribed some antipsychotic, well, forgive me, but only a monkey who knows nothing else at all could suggest that. Or a pharmaceutical company that doesn't care about health, even if they claim it's their mission, and just wants to push their poison. What could be happening with this person? Since there is very little data, I can say that he might have cancer. And what we are seeing is increasing cancer-related intoxication. He could have problems with his pancreas. He could be developing worsening vascular issues, or perhaps even a minor stroke. There is absolutely no information about what this person does for a living. Maybe he started working in a hazardous industry and he's experiencing increasing poisoning from industrial emissions, yes, heavy metals or something else, right? We don't know what this person eats. We don't know who this person lives with. We have absolutely no information about his life or his physical condition. But what is the doctor already supposed to do according to the pharmaceutical company's suggestion? He is supposed to prescribe him an atypical antipsychotic, that is essentially a neuroleptic. And this neuroleptic will poison the patient. And what will we get in the end? We will end up with either an early death or a severely disabled person. But in this way, the cause will never be determined. Why? What kind of catastrophe is continuing in this person's body? I just want to. Why did I tell you this? Because if your relative is experiencing similar problems, or you yourself are experiencing such issues, and if you go to a psychiatrist hoping that they will sit down, take a detailed medical history, send you for tests, and try to find out the cause of this psychosis, forget it, just forget it. Nowadays, doctors are trained on which button to press. Right now I'm moving my mouse and I see all these various beautiful names of neuroleptics. Which neuroleptic should I click on to prescribe treatment for this person? In my book, This Crazy Psychiatry, I talk about how can psychiatry become the queen of medicine. Read it. In reality, a psychiatrist can serve as a stable point of reference, acting as the primary specialist who carefully unravels the complexities of a situation, because they can observe the various changes in the human psyche. Changes in the psyche are the very first thing we observe in various pathologies, because the psyche is the highest form of nervous activity. And when the body encounters a problem, the first thing it disrupts is higher nervous activity, because from the perspective of nature, it is not necessary for the organism's survival. Nature needs to preserve the heartbeat, the blood supply to the brain, and so on, right? Respiratory function. Higher nervous activity in nature is That's why when we look at children with delayed mental development, we need to go through the process of restoring the body with these children and their parents. And only when the body is doing well does improvement in mental functions begin. Because, forgive me, nature doesn't care about mental functions. It needs breathing, a beating heart, a working brain, a functioning gastrointestinal tract, an excretory system that works, kidneys that excrete. That is the task of the life of the animal body, of animal life. Do you understand? What do we see here? Here we see a collapse of mental activity, and we absolutely do not see anyone prompting the doctor to. There is nothing said here about which somatic specialist you should refer the patient to first. What blood test, urine test, I don't know, a comprehensive one, whatever you like. What will you do for which atypical antipsychotic will you prescribe for him? So don't think that if you go to a psychiatrist now, if you have some kind of problem, you will get the thorough case analysis that I talked about and that I describe in my book, This Crazy Psychiatry. You'll just get these ABCs of which atypical antipsychotic to prescribe. Because unfortunately, medicine is crushed by the money of pharmaceutical companies. Doctors are crushed by the money of pharmaceutical companies, and medicine itself, as a philosophy, as a field, as a specialist, a doctor as a specialist who studies a person, who searches for where the malfunction is, how to turn the situation around. Unfortunately, the doctor has now been destroyed as a philosopher. The doctor has been destroyed as a professional. And now all that simply remains for him is to clumsily poke at these silly little buttons labeled atypical antipsychotics. It is all very sad. It is just so incredibly sad. I sincerely hope that there are doctors who do not succumb to this terrible trend and who bring real medicine to their patients, and who can and actually understand what is happening and do not agree with this criminal destruction of medicine. This was Sofya Dorinskaya with you. All the best. Goodbye.